Hello and welcome to the Foxwood County Public Safety Academy First Aid CPR AED course. Today we will be covering recognizing an emergency, check call care priorities of care outline, your obligation to act, personal safety, identifying an emergency, controlling bleeding, giving CPR, and using an AED. It is highly recommended that you take notes. Section 1. Before giving care. Recognizing an emergency. The first thing you have to do is recognize an emergency. Things that may alert you are someone yelling for help, witnessing the emergency happen, such as seeing someone fall or faint, and someone directly alerting you of a situation, such as a friend knowing you are certified, coming to tell you that something has happened. Deciding to take action. Once you recognize an emergency, it is up to you to take action. You're classified as a lay responder, so you don't have any legal obligation to help anyone. However, the purpose of obtaining such a certification as this is to help when you can until EMS or higher trained professionals take over. When you recognize an emergency, it is you who must decide to take action and do your best. As a lay responder, lay means laid back. You're not a professional responder. You're a civilian, and you have no duty to act, no legal obligation to act. But you do have an ethical and moral obligation within yourself. The purpose of a certification such as this is to increase the confidence within yourself in taking such a course and providing this level of care. Responding to an emergency. When an emergency has been recognized and you decide to respond, the next thing to do is check, call, care. Check the scene for safety. Your safety is number one priority. If the scene is not safe and you become injured, ill, or dead, then you're no help to anyone and only create a second victim. Don't become the second victim, because that creates more work for other responders and decreases the chances of patient survivability, because now EMS has to treat two patients. Second, if you determine the scene is safe, check the patient fully before providing any care. You can't provide care if you don't know what's wrong with the patient. If you only partially check the patient, you may miss something, and the patient may die as a result. Call 911 and activate the EMS system. Always do this when you can in order to respond higher professionals. There are some cases, though, where you don't need to call first, and we'll cover those in a further segment. Provide care as trained. In this course, you will be trained to provide certain levels of care, and after that, you can provide those levels of care to anyone who needs it. Call first or care first. If you are alone with an injured person and can't ask someone to call you, do you call first or do you care first? In these situations, you should call first. Situations such as having a cardiac emergency, someone in cardiac arrest, having a heart attack, or another cardiac emergency. Anyone unresponsive. So, in a later module, we will cover checking for responsiveness, and anyone who is unresponsive you should call 911 immediately. Anyone who is not breathing, in a later module we will cover how to check this. If they are not breathing and not responsive, they are probably having a cardiac emergency. So all three of these fit together. And in any case, after you finish checking them and determine that that is what's wrong with them, one of the three or all three, then call 911 immediately. And of course, someone who you've seen collapse. If you've seen them collapse, call them. Call 911, because this person probably should not have collapsed. Unless they have a known medical condition that causes that. In these cases, call first decreases the time it takes for EMS to arrive, and possibly an AED, which could save the victim's life. In these situations, you can provide care before calling. If you didn't see them collapse, you don't have to call first. You can continue checking the patient further to determine exactly what is wrong with them, such as doing a full head-to-toe assessment, especially if they don't meet any of the other call first requirements. If someone is bleeding, you can try to stop the bleeding before having to call. A lot of times bleeding can be stopped without having to call EMS, and the person can either continue on their day or be self-transported to the hospital without needing to tie up emergency medical services or waste your money on emergency medical services. A choking victim could also be treated first. When people are choking, it is often the civilian first responders who have to provide care first aid, because the Heimlich maneuver, or abdominal thrust and back blows system, allows first aid responders to try to dislodge the obstructing object in the person's throat long before EMS could arrive. And if the person continues choking, they will eventually pass out, become unresponsive, and go into cardiac arrest, in which case you begin CPR. So, choking, you provide care first, and hopefully try to prevent them from getting in a spot where you need to call 911. Even after choking, though, you may still need to call 911 afterwards for post-choking care, but you can and should provide care first, especially with choking. Alright, and then allergic reactions finally. With an allergic reaction, you're gonna have someone who's not breathing well. They're having maybe an asthma reaction or an allergic reaction to something, their airway's closing up. So most people who with allergic reactions can either carry pills or carry an EpiPen with them to help deal with their reaction. So what you want to do is help them to self-medicate, help them to put their EpiPen in, or help them to get their medication for their allergic reaction. Give care first, and if needed, call 911. Personal safety. To keep yourself safe, you should use PPE, or personal protective equipment. PPE includes nitrile gloves and CPR masks, or face shields. Scene safety and scene size up. Before rushing to help an injured or ill person, you should size up the scene. Use your senses. If it looks unsafe, don't go in. Look for chemicals or dangerous traffic, fire, or other dangers. Form an initial impression in your mind about what is wrong with the person. Look at the environment around and see if anything in the environment may have contributed to that. Because if it did, it could contribute to your getting harmed. Sizing up the scene will help you determine your immediate next course of action. A good example of this is a scene with barrels turned over and chemicals on the floor, and you see people passed out. You wouldn't want to go into that scene because the chemicals may be the cause of them being passed out, and you could become a third victim. Section 2. Checking a patient. Obtaining consent to help. Before you can give care or assess a conscious patient, you must obtain consent. To obtain consent, introduce yourself and state your certification. Ask if you can help them. If they say yes, you may assist. If they are unconscious, you don't have to ask. You'd assume that they'd want you to help them. This is called implied consent. Checking a responsive person. If you determine an injured or ill person is not having a life-threatening emergency, you may begin to gather more information. You can do this by using the mnemonic sample. It is important when taking a sample history that you write everything down. Now, in some cases, if you have multiple first aid trained individuals, you could have a second individual take a sample history from the family, especially if the victim him or herself, is unable to speak for themselves. Have family or friends nearby give you a sample history. More will be covered on this in a later tab. SAMPLE stands for Signs and Symptoms. Some questions that you should ask to help you determine this is, what are you feeling? Are you in pain? How long have you felt this way? What does it feel like? And how bad? On a scale of 1 or 0 to 10. 10 being worst and 1 or 0 being least. Allergies. Do you have any allergies to anything? I.e., meds, food, or nature. If they're allergic to certain medications, foods, or plant life. It is important to know that. The M stands for medications. Do you take any meds? What do you take? It is important to know if they take medications, especially when you ask the next question. If they do take medications and these medications are pertinent or relevant to the next question, then you should gather any and all medications that they take or have taken recently and have them ready for EMS. When EMS arrives to an emergency, they generally want to know what medications someone takes and want to see. So if possible, gather all medications for EMS. Past pertinent medical history. Again, pertinent meaning relevant, because you don't want to learn about their entire medical history. You just need to know what's relevant to the emergency at hand. So, a few good questions to ask here are, do you have any medical conditions? If they have a medical condition, this may be contributing to their current emergency. Has this happened before? Let's say someone is having a heart attack. Has this happened before? Well, if they've previously have a heart attack, they may be at higher risk to have a second one. So if you suspect one and they have had previous heart attacks, this may be a high indication that it is in fact a heart attack. Furthermore, if they have previously have a heart attack, they may have medications for it that could save them. And that's why this is important questions to ask. Another one is, what conditions do you have? A lot of times if you ask, do you have any medical conditions, someone will just say yes. So it is also important to ask what. And how long ago did this happen? Let's, again, with the heart attack example, if they say that they have had something before, you know, they are having heart attack symptoms, and you ask, has this happened before? They say, yeah. You ask how long ago did they have their last heart attack. And this can also help you to determine their risk for having a second one. And again, you'd need to gather all the medications relevant. Last food or drink or last intake. So when they say last food or drink, they really mean last intake. When's the last time you ate or drank anything? And you should also ask, when's the last time you took anything at all these days? Because if someone used a needle to inject drugs, that's intaking something. So you want to find out what's the last thing the person took into their body, because this could be contributing to their illness or injury, and will also help EMS. And again, you want to write all of this stuff down so that you can hand it to EMS, because EMS is going to want to be able to read it, and they may even ask their own sample again to try to learn more. Events leading up. What were you doing before this happened? You want to know what happened before they became ill or injured, and what might be the cause of it. Because 9/10 of the law when treating someone is treating the cause of their illness or their injury, not actually treating the illness or injury itself. After sample assessment, you can do a head-to-toe assessment, methodically checking the patient from head to toe. You do this by first obtaining consent. You want to do this and of course respect their privacy, respect their personal space, and be very professional in the way you do this, because you're going to be up close and personal and touching the person. So you do need to obtain consent, especially specifically when they are conscious. Then feeling and looking around from the head down. Methodically palpating behind the ears, rubbing the scalp, looking for fluid behind the ears, in the ears, bleeding, scratches, bruises, whatever. You're looking for deformities, swelling, tenderness, anything that might indicate broken bones, anything, any kind of injury whatsoever. And you want to look behind the ears, the scalp, arms, neck, chest, abdomen, and legs. Just working your way down from the head down. That's why it's called a head-to-toe assessment. And again, be respectful of the person's privacy. Very important. Checking a person who appears to be unresponsive. If you come up on a person who appears to be unresponsive, or someone who you saw faint, they look like they're unconscious, you need to check them for responsiveness. This is done by the shout, tap, shout method. Now, it is very important to note that unresponsive and unconscious are not the same thing. Unconscious means they are not aware of what's going on around them. So basically like being asleep. Unresponsive means that no matter what they do, what you do to them, they don't respond. They don't flinch, they don't blink or speak or groan, nothing. If you mess with a sleeping person who would be considered unconscious, they usually groan or move or flinch or something like that. But if you mess with an unresponsive person, there will be nothing. So check that with the shout, tap, shout method. Shout is, and it's just what it sounds like. You shout at them, call their name if you know it. Sir, can you hear me? Tap their shoulders in a hard / firm, but not a harmful manner, such as doing this. You want to have both hands, one on each shoulder, and just tap down somewhat hard so that they can feel it, but not to where you would injure them. If there are response, and then of course shout again as before, sir, can you hear me? Or ma'am. In this example we're saying sir, but I don't want to gender exclude. They are responsive if they flinch, groan, or speak, or really any type of response at all. Unresponsive means unresponsive. That nothing happens at all. Okay, so any kind of movement or sound is a response from that patient, and but they'd still be unconscious, and unconsciousness can also indicate something wrong. But unresponsive is life-threatening emergency. If they are unresponsive, of course, if they do nothing, and this means they are in a life-threatening emergency, and you need to move to look, listen, and feel. Covered in the next tab. Look, listen, and feel for no more than 10 seconds. Put your head near the patient's face with your ear over the mouth, looking down the chest. You do this so that while you're looking down the chest, you can look for chest rise and fall. Your ear is by the patient's mouth so you can listen for breathing. And your cheek is also by the patient's mouth so that you can feel breath coming from the mouth. And you can also place your hand on the person's chest to try to feel for chest rise and fall. Now, if the patient has no chest rise and fall, is not breathing, or is gasping only once in a while, or even gasping constantly, gasping is not considered breathing. Gasping kind of sounds like this. Then you need to do CPR, covered in a further tab, and call 911, of course. If you feel chest rise and fall, but no air from the mouth, the airway is obstructed. And you may feel chest rise and fall because the person is trying to breathe, but there's no air coming in and out of the mouth because the airway is obstructed. And this may be, of course, seen after doing Heimlich maneuvers on someone, or chest abdominal thrust and back blows on someone in order to dislodge an obstructive object, and it's failed. You may notice this happen where their chest seems to want to rise and fall like it's moving, but there's no air coming out, and that's just the muscle contractions automatically happening, but there's no air transition occurring. And of course, the chest rise and fall may stop after choking due to the heart going into cardiac arrest and not pumping blood to the muscle, so the muscle stops moving. That's why it's very, very dangerous for someone to be in cardiac arrest. Section 3. Cardiac emergencies and giving CPR. A heart attack. If you suspect someone is having a heart attack, check for these symptoms: sweating, chest pain, trouble breathing, paleness of skin. When I say trouble breathing, I'm talking about like shortness of breath. They'll be breathing very shallow, very short. It's kind of a hard thing to describe, but you kind of get the idea from that. And then discomfort or pain that spreads to the arms. It usually starts in the left side of the chest or in the shoulder, and then the pain will spread down to the arm. This particular symptom is especially common in women. And then fatigue, anxiety, or a feeling of impending doom. These are all common symptoms with someone who is having a heart attack. If you determine it to be a heart attack based on the previous part, take these steps. Call 911, of course. Get 911 en route because they can do the most good for this person. Be ready to give CPR and get an AED. In other words, have yourself mentally prepared and have yourself ready to run and grab an AED, or have someone else ready to run and grab an AED for you. Help the person rest, relax in a comfortable place, and calm them down so that they can survive longer. Do sample assessment, find out if they take meds, if they've had this happen before, and of course gather any meds for EMS. Reassure the patient, try to keep them calm and comfortable. You want them to relax so that they don't make their condition worse. If you can't have access to aspirin, you can give them either 4 81 milligrams aspirins or 1 325 milligram aspirin. 81 milligram is low dose, 325 is standard dose. If the patient is conscious and able to take them themselves, this may stop the clotting that is causing the heart attack, as aspirin is a NAS aid, it's a blood thinner. Of course, hand the patient the pills and let them take the medications themselves. They have to be conscious and able to take the medications themselves. You can't administer medications. And of course, continue to monitor their condition and provide reassurance till EMS arrives. Don't give false promises though when reassuring. You just want to try to reassure them and tell them it's going to be okay, but don't lie to them or give them false promise in anything. Cardiac arrest and the cardiac chain of survival. Cardiac arrest occurs if the heart stops beating. It usually happens suddenly with no warning. Though a heart attack may lead to cardiac arrest, it is a completely different condition. A person in cardiac arrest is not responsive, not breathing, and has no palpable pulse. If you suspect cardiac arrest based on look, listen, and feel, you should consider and follow the cardiac chain of survival. As you can see in the picture, the cardiac chain of survival says the first link in the chain is you, the lay rescuer, with recognition and activation of the emergency response system. This is an important link in the chain because later on, EMS needs to be able to provide early advanced cardiac life support care. Once EMS arrives, or you as a lay responder needs to begin immediate, high quality early CPR. As soon as possible, an AED should be used. Early AED usage is an important link in the cardiac chain of survival. After that, the lay rescuer's role ends, and it transfers to EMS and higher personnel if the patient survives to this stage, which of course we all hope they do, and if the cardiac chain of survival is followed properly, they generally do. This is not to ensure that they survive, but to give them the best chance to survive. Don't be afraid to help them, because without you, they'd have no chance. You're giving them the best chance they have to survive by providing early CPR, early activation of the 911 system, and early AED usage. After your involvement, it transfers to early advanced cardiac life support care from emergency medical services professionals and transport to a medical facility for continued advanced life support care and post-arrest care. Cardiopulmonary resuscitation, or CPR. CPR is done as follows. Take your hands, place your dominant hand on bottom and your non-dominant hand on top, and interlace your fingers with your palms facing down. Lock your elbows. And put your hands in the center of the chest, just above the nipple line. Compress at a depth of about 2 inches, or at least 2 inches on an adult. Do 30 compressions to 2 rescue breaths. You want to bend from the waist. You want to lock your elbows and bend from the waist so you put your whole body weight into each compression. And it'll make these compressions easier. Allow the chest to fully recoil between each compression. You want to do your compressions at a rate of approximately 100 to 120 compressions per minute. Optimum rate is about 100 compressions per minute. Reassess, look, listen, and feel every 5 sets of 32 or every 2 minutes. Every 5 sets of 32 is also equivalent to 200 compressions if you don't feel comfortable doing breaths. You should try to minimize how much you stop CPR, so if a second responder can give breaths, then they should do that. You want to try to keep compressions going as much as possible. If you don't feel comfortable doing breaths or have a second responder to do them, do compressions only CPR. Do 200 compressions over 2 minutes and reassess vitals every 2 minutes. Automated external defibrillator, or the AED. AEDs can be used in any weather conditions at all. So don't worry about if you have to use one in the rain. It's perfectly safe to use. AED usage. Cut open the patient's shirt if not already off. Turn on the AED and follow the AED's prompts. Place one pad on the lower left abdominal side, just at the bottom of the rib cage. You don't actually want to place it on the abdomen. You want to place it just above the bottom of the rib cage on their right side, the patient's right side. Or actually, that would be their left side, sorry. Their left side. And then that would be your right. And then place one pad on the upper right of the chest, which it would be your left if you're looking at them. And that's going to be above the nipple line and below the collarbone, just over that corner of the chest, kind of next to where the shoulder joint is. Once the pads are applied onto the person's chest, and please do note that when you use an AED, usually the pad will show you where it's supposed to go. So just follow the prompts, look at the pictures. AEDs are easy to use. Plug the pad into the connector. The AED will prompt you to do this, and then clear for rhythm check. Again, the AED will prompt you to do all of this. So don't worry if you don't remember, because the AED will prompt you. Clear for rhythm check and wait for the AED to advise whether to shock or continue CPR. Ask the patient if shock is advised via role play, and if you're doing that. If shock is advised, clear for shock. Tell everyone to stand clear. And of course, make sure that nobody's touching the patient this entire time during rhythm check, because if someone's touching the patient, it may detect a pulse and then not give a shock when one is needed. And of course, once shock is advised, you want to clear again. Make sure everyone, wave your arms over the patient and yell, "Everyone stand clear." Make sure nobody is touching the patient at all, including yourself. Once prompted and the shock button is flashing and everyone is clear, press the shock button to deliver the shock. The AED will deliver the shock and then tell you that it is analyzing the patient again. Again, nobody should be touching the patient during this time. The AED will then advise if to continue CPR after the second rhythm check. All AED prompts All AED prompts are simple and easy to understand. Note an AED can only shock ventricular tachycardia or VTAC, which means the ventricle in your heart is beating too fast, and a lot of times it's beating so fast that you can't even feel a pulse. So the person is still pulseless. Or ventricular fibrillation, which is also another pulseless condition of the heart, in which the ventricle specifically quivers. It's not beating, it's just quivering in place. And so both of these are the two most common types of cardiac arrest, and they are the two main ones that an AED will shock. Section 4, bleeding control. Life-threatening bleeding. If someone has a spurting bleed from an artery or flowing blood, it is from a vein. It must be stopped. To stop bleeding, you should get on your personal protective equipment, especially here, because you're at an extremely high risk for transmission of sexually transmitted diseases or bloodborne pathogens. So wear that PPE. Apply a large 5x9 gauze pad or a 4x4 gauze pad to the bleed and apply direct, firm pressure. The life-threatening bleeding continued. If the bleeding continues and it is spurting arterial bleeding, you can use a combat application tourniquet. You cannot use a CAT tourniquet on venial bleeding because the venials are typically deeper in the surface. CAT tourniquets are specifically used for arterial bleeds. Also, it is important to note that an artery is the blood that's flowing away from the heart, and the veins is the blood that's flowing back towards the heart. So by applying a tourniquet, all you're doing is stopping the blood from flowing back to the heart. It is also important to remember that you can only use tourniquets on extremities. Now, while there are many types of current tourniquets, one of the best ones we recommend that's very common is the CAT tourniquet, or combat application tourniquet. So wrap the CAT tourniquet around the arm or leg or other extremity. Secure the buckle so it is snug and tight. Then crank the handle till the bleeding stops. To make sure that it's tight enough, you can check the hand for feeling, warmth, and color. See if they can feel you touching their hand, if it's warm, and if it has color. If it doesn't have any of those things, then the tourniquet should be tight enough to stop bleeding. If bleeding is somewhere you can't hold pressure, such as in the armpit or the pelvis area, any fleshy part of the body, where you can't get a tourniquet and then you can pack a wound. Take the gauze roll and wrap some around your finger, stuff it into the room, and use your finger to apply pressure directly onto the vein. And then you just want to take your other hand, wrap some gauze around it, and apply more pressure into the vein, and just keep switching your hands off and pushing more gauze and more pressure into the open wound. And you can do this for venial or arterial bleeding. If you need to use hemostatic dressings, be cautious and read labels. And of course, only apply to venial bleeds, do not apply to arterial bleeds, and secure in place once applied. Make sure you read all instructions and warning labels before using such a bandage, and it is also best to be experienced and specifically trained on use of these such bandages before using them. Always consider calling 911 for life-threatening bleeds. Bandaging. Once bleeding has stopped, you may bandage. Apply a clean gauze pad, clean and sterile gauze pad that hasn't been bled all over, Wrap loosely snug, and I say loosely snug because you don't want it too tight to where they don't have feeling, warmth, and color in their hand, but you want it tight enough to where it maintains pressure and helps to prevent clotting from undoing. So snug but not over tight. Wrap the gauze, of course, in overlapping layers, at least one each on each side, just going around and around and around, going back and forth, so that you cover the whole thing, about 1 inch on each side of the wound. And then tie a snug knot on top of the gauze directly above the wound in order to maintain pressure. Now, something to note that's a great way to get that knot is with your last about 12 inches of gauze, you want to fold that in half, twist the end where it made a loop from folding in half together, and then use the flat end and the twisted end, go around the arm to the top, meet on top, and tie basically a shoe knot on top, and that will hold down pressure. And basically what you're doing is you're creating two ends of a rope by doing the twisting, and now you can secure that wound successfully. Special note that life-threatening bleeding comes before everything else, including CPR. If CPR is necessary based on look, listen, and feel, only do what is necessary to slow the bleeding and stop if possible. Take no more than 30 seconds to intervene with the bleeding before beginning CPR. Don't delay CPR if you can. Now, the reason that this is because of the fact that if someone has, especially an arterial bleed, but and veneal bleeds included, if you begin doing CPR and they have blood spurting out of an artery, all you're going to do is push that blood out faster by doing CPR. A normal person's pulse rate is between 60 and 100, but if you're doing CPR, you're doing at the top end of that and above. So you're doing what would be considered a very high pulse, essentially creating a high pulse for that person by taking over what the heart is doing and doing a manual pulse. And you're making the heart beat and pump blood throughout the body. So by doing that, you are causing them to bleed out faster. And so the CPR will end up doing you no good because they'll just bleed out and die that way. Very important to note that. Section 5, simple first aid. Now, Section 5 covers basic minor cuts and scrapes, and this shouldn't be something you think it'd be common sense and we wouldn't cover it, but we do because it's actually very important that you do treat minor cuts and scrapes correctly. So you want to clean the wound using soap and water if at all possible, or if not available, use an alcohol prep pad or APP. Infection is your greatest risk when you're dealing with minor cuts and scrapes, so you want to clean those wounds and prevent infection. Take a sample history to determine if they have any allergies to ointments. If not, you can apply a triple antibiotic ointment. Apply generously, but don't over apply. Make sure to only apply it on top of the wound and not the area around the wound, because you want to be able to stick the bandage to the skin, and if you grease up the area around the wound with the petroleum-based ointment, it's going to act like oil, and it's going to make it impossible for the Band-Aid to stick to the skin. And of course, finally, apply a Band-Aid. Band-Aid is actually a brand, so the generic term for all bandages is adhesive bandage, but for lack of a better term, because we all do it, we're going to call it a Band-Aid. You use a clean and sterile adhesive bandage or Band-Aid. Make sure the bandage covers the entire wound plus a couple millimeters. So when we talk about the bandage, you can think of a Band-Aid as like the sticky brown part on the back being the gauze roll, like we were talking about in the last segment, and the white pad that's on the other side as being the clean, sterile gauze pad. The only part of a Band-Aid that is actually sterile is that white gauze pad. So you want to make sure that that white gauze pad specifically is slightly larger than the size of the wound it is covering. And then just apply the Band-Aid as normal, you know. Section 6, illnesses. And this is the final section. Seizures. Identify a seizure by shaking or convulsing that is uncontrollable. The person is usually unconscious and may be vomiting. You want to move away. To treat, you want to move away any furniture or hazards nearby that may injure the person further if they weren't injured during falling or passing out in the start of the seizure. Don't touch them until the seizure is over. Don't stick anything in their mouth. If they start to vomit, you can touch them to roll them on their side into the recovery position and hold them there. Or if they become apneic during their seizure, meaning they're not breathing, then you can use a head tilt chin lift to try to open their airway during the seizure. But whatever you do, don't stick anything in their mouth, and just focus on trying to prevent further harm to that person. Let them run the course of the seizure. Don't try to stop them from having a seizure, like hold them or anything. Let the seizure run its course. And of course, especially if it's not from a known condition such as epilepsy or something like that, where they are known to have repeated seizures, call 911. Seizures are not normal, and if someone is having one and doesn't have a medical condition to explain it, then a seizure can be an indication of a life-threatening emergency. After the seizure, if you didn't already have to do it, go ahead and roll them into the recovery position because they may vomit after the seizure, or they may just need to have their airway opened, and the recovery position helps to open their airway as well. And of course, treat for shock after the seizure. Go ahead and treat for shock, which is covered next. Shock can be identified by someone who is feeling cold, shaking, has nausea, refuses to eat or drink, or altered mental status. Shock usually occurs after traumatic events, illnesses, or injuries as a secondary byproduct, and can affect your major organs and is considered a life-threatening emergency. If you suspect someone has shock, go ahead and call 911. And of course, with almost all first aid situations, you want to treat for shock. So treatment, you want to raise the feet, you want to lay them down and raise their feet up above their heart so that the blood goes to the vital organs. Wrap them in a warm blanket or mylar space blanket. If they're conscious, you want to reassure them. And you don't want to give them water. Just reassure them, keep them comfortable and warm, and try to elevate their feet. Finally, stroke. To identify stroke, you want to think fast. Face, arms, speech, and time. Ask them to smile. Is it droopy on one side? Ask them to raise both arms. Does one hang lower than the other? Ask them to repeat a simple sentence. The sky is blue. Can they speak? Are they speaking gibberish or sluggishly? Also consider when you have them speak if one side of the mouth, and specifically the same side of the mouth as when you ask them to smile, is drooping or not moving while they're speaking. Strokes happen on one side of the brain. So if I have a stroke in the right hemisphere of my brain, the symptoms will show up in the left side of my body. My left eye may be lazy. My left cheek will be droopy. My left arm would hang lower. So that is something to consider as well. The strokes will only happen in one side, and whatever side of the body you see symptoms on is the opposite side of the brain where it's actually happening. And of course, time. Record the time these symptoms are noticed, because that affects the treatment that the EMS will provide. It's very important to give them that information as accurately as you possibly can. And then treatment, of course. Call 911 right away. Get EMS en route. Treat for shock. And reassure them, keep them comfortable as best as you can. Alright. This concludes our first aid, CPR, and AED course by the Foxwood County Public Safety Academy. Credits to myself and to the owner of the Foxwood County Public Safety Academy and the American Red Cross for the curriculum used here today. We'd like to thank everyone at the Foxwood County Public Safety Academy as well as the Waukesha County Technical College for inspiring this format of video. And also we'd like to thank the National Registry of Emergency Medical Technicians for helping us out with this software. So thank you for watching this training video from the Foxwood County Public Safety Academy, and I hope you do well in your first aid, CPR, and AED training course.